Our next speaker would be Mr. Henry Tillman, who is from England. He is the director of the China investment research at the UK, and I would welcome you, Mr. Tillman, to make your remarks to the webinar. Are you?
Yes, thank you very much. Yes,
Yes.
thank you very much. I thought I'd just do 3 quick introductory remarks before I jump to the slides, because it segues into everything I've heard for the last 2 hours, fortunately. Number one, on the returns and the CPEC and those investments, I can confirm about Pakistan's great returns the last few years. I'm presenting a webinar looking at returns in Pakistan, Bangladesh, Uzbekistan, Kazakhstan on the 18th of May, and a webinar here in the UK for the City of London. So I can confirm what I've heard in frontier markets. Returns are very strong, whether it's venture capital or private equity or IPOs. Point 2, back to you, remark, Stephen. That's my one job, is the financing side. The other job is I run a proprietary database, and that database is based upon facts, which are linked to numbers, which are linked to raw data. And I do that in conjunction with universities. So I publish with China, and it's done on an academic basis. And what you're going to be seeing in a few minutes is based upon that. And we were honored to be published in conjunction. We co-authored with China, which is a rare feat, as Michele knows. And 3, Michele, this was what you're seeing today was actually excerpted and used at the Bao Forum last week. It was we were the cover story with the Beijing Examiner. I just couldn't go. I couldn't spend 2 weeks in a hotel, unfortunately, although I'm going to have to do it in November to speak for Shanghai City once a year, Belt and Road. So, yes. And finally, Stephen, it does segue into what you talked about. There are ways that it's actually collaborating and working. So I want to show something quite concrete that people don't focus on. So with that as a start, I'll go into the share screen. This now straight away. Just a second. Slideshow should work. There we go. So what you're going to see here is only, and I've not done this for anyone in the West. This was done in conjunction with the Chinese government. It was approved by Ministry of Foreign Affairs, Ministry of Health, and MOFCOM. And it's our data. It was it took me 6 months, 19,000 words, 400 footnotes, and 500 companies we analyzed to pull this together. And it was, again, published by SIIS. It's released throughout Asia. I've not released it in the West for the reasons you're going to see in a few minutes. And they've asked me to keep it among friends, so which is what I'm doing today, because I know and trust BRICS. And Michele, your reputation goes ahead of you with my friends, and my friend Francesca, who sings your praises, basically. So with that as a background, it's in 6 months of work, and it's driven around data. So as you first heard, this is what it looks like. I always show people what it looks like in October of 13, just to remind people that's the way it looked just, less than 8 years ago. Then what I show is by quarter, just again, for the Health Silk Road as a brief entry for those of you that don't know it. China first started dealing with helping foreign countries in healthcare in 1963 in Algeria. And it wasn't only just for good news, because basically Algeria helped with automobiles or like trucks they couldn't get from Russia. And then it went through Western Africa, across Africa, into Central Asia, and they built their first TCM, Chinese traditional medicine, in Afghanistan in 1975. So there's their 60-year history, 70-year history that China has done in this. And then, of course, if you didn't know this, it was first mentioned in 2015 by Chinese the party itself. It was launched in August of 2017 when President Xi said it in conjunction with the WHO. And then there were a couple of years when they started to roll out, but it didn't go that quickly, and it was only on certain diseases and certain medication. There was a great study done in April of 19 that talks about those first 2 years. And then because of COVID, it all changed very quickly. So what you see here in the next few slides, because there aren't many slides, is how China went from the 4th of January, really in difficult position in Wuhan, to the 4th of March when they got control of it and said, we're going to go help the rest of the world. So in a period of 4th of March to the end of October, which is 7 months, China reversed this and provided aid to over 150 countries. And you'll all know the story from so many people I've read about. Here's this medical aid and here's this medical aid. What we did, because I'm like McKaylee, I'm an ex-banker, still I'm a banker, I looked at all the numbers associated with that. So it's just not the medical assistance, it's all the things that go around it. We'll show you the various components. And it also then fed into the biotech industry of China, which was funded by technology from international markets and also from funding from international markets. So here's the first slide, Q319. You can see the blue, really it's the blue, that's the Belt and Road you see. But the blue dots are basically, these are countries receiving equity investments from China. And to give you some idea what's happening here, despite what regulators are saying, China started going into minority stakes and into investments less than 10 million US and 10% or below FDI in 2018. So by 2020, half of those investments externally are less than FDI and therefore not going to get a lot of attention from regulators. And you can see there's just a few blue dots where they were investing. And I should also say what we don't have in this document and what I didn't put through on the big document is all the inbound stuff from Europe beginning in 2005, which really helped build the biotech industry technology-wise in China, and especially from 2010 to 2020, when that was backed also by the Chinese government. So a few dots, all blue, all outbound, and that's the first quarter. This is, again, pre-COVID. Next slide, a few more dots, still all blue. These are countries just receiving equity investments from China. And I would say, realistically, the inbound also had the same number of dots from locations, but also the actually inflows in healthcare have been greater into China, at least those first two quarters, than they were outbound from China in those quarters as China continued to build its biotech industry and experiment with the whole concept of building vaccines. Then we go to Q1, and you start seeing other things that China is doing besides just that. So you see in the center, those are the medical assistance countries. You see those are 33 of those in the first. And we find those quite interesting because you see who gets the first call from China relative to medical assistance in Q1. You see an increase of flows from China investing in equity investments in those other countries. Again, these are very few controlling stakes. They're mostly growth capital to grow biotech and life sciences, as we heard. Well done, Denmark, for looking at this. So we're doing the UK as well. On the lower left-hand side, you see China then made its first, over 2 quarters, it donated 50 million to the World Health Organization. That puts them in 194 countries. And on the right-hand side, in the green dot, you'll see the first policy bank loan was made to Sri Lanka. So again, you can see the difference between, you can certainly see the difference between Q3, Q4, and Q1 with COVID. Here comes Q2. Incredible. That's why I don't show these dots. I don't show this in the West for the reason Stephen talked about a few minutes ago. 31 countries outbound, another 25 million into World Health Organization, and 75 countries now receiving medical assistance. And on the right-hand side, you see COVID loans from AIIB, and you also are seeing COVID loans from NDB. So if the West would see this, they would panic because of all the dots and how fast this moved. We finalized in Q3 because I had to end the data in Q3, but I'll follow up with specifics. Again, you see on the left-hand side the number of outbound investments. These are mostly joint ventures or drug licensing agreements. You see they've doubled in the last year. You see in the middle that we start talking about medical assistance in regions. We'll come on to this in a second because the Belt and Road is built on a hub and spoke model, which I didn't know about until China confirmed this with me as part of this Bao Forum. So you see the SCO we put in one bunch. We think CPEC is also much more than just Pakistan. We can talk about later. You then see loans below to Latin America. There were 13 countries involved in that. for $1 billion to afford vaccines. You'll see AIIB COVID loans. Then you see NBD loans below that. And then you see, again, vaccines on the right where they're being tested. So again, we don't put these overlay because I think it sends a strong enough message by quarter, the number of dots by quarter. So our data stops at Q3 because we were supposed to publish in Q4, but my professors I work with at the think tank at SIIS had a book launch in Q4, so we didn't publish till Q1. So what I did for various different Chinese publications and from the think tank is update it through Q4. So here's the vaccine launch. To give you some idea of vaccines, you see that by the end of the year, these are the countries where there's either currently approved or signed agreements or under review. You'll see roughly 17 countries at that time. And again, to remind everybody that China launched its first vaccine a fortnight after Pfizer launched it's theirs. And again, to remind everybody that by 2010, basically China really didn't have a biotech industry. This biotech industry was built, again, from technology from the West, USA, Western Europe, North Asia, although it was a much smaller percentage from North Asia, Japan and Korea, and smaller bits. But again, it helped them produce these vaccines. Now, we didn't put this in here, but this also led to tremendous profitability for Chinese biotech. So the four largest biotech companies, the four largest vaccine companies in China last year produced shareholder returns for their shareholders between January 1 last year and 31st December last year of 30 billion. To vaccinate the world, you need 35 billion. So this became an overnight industry in a year, which China basically is becoming a leader in, which I'll show you in the next couple of pages, producing large amounts of returns. What our paper didn't discuss, and we left it clearly very open because I don't do politics very well, as Hussein knows. I left it open saying this is the amount of money produced by these profits. And if you look forward, this will be even greater going forward because this will be a multi-billion. I think Credit Suisse estimates it's a 20 billion industry. I think that underestimates it because I think COVID or its form or its variants will be around for a number of years. So this could be a multi-20, 30 billion, 40 billion industry. And again, you're looking at probably 10 Western players and probably 15 Chinese players. So after Q4, this is dated as of Q1, who's doing what, where. This is the domestic versus exported. You'll see the numbers, which are pretty clear about how much China is keeping versus how much they're passing along. And you see USA, India, EU, and UK. Again, this is dated as of 21st March. And, this varies daily based upon a number of factors. But I wanted to say also by this time, at the end of March, China was now testing 15. They had 5 approved vaccines. They had testing 15 total vaccines in 12 different countries. So this is how fast this has grown so quickly in 1 quarter, from 2 approved vaccines to 5, and from test of 5 to test of 15. So this is how fast this is growing and how China's just grasped the nettle. And then finally, to show you, this is just a list of distribution by country. These are 83 countries, various different distributions, which you'll have this. I don't want to go through it with you, but basically China was at the end of March was leading with, I think, 83 countries where there was some either testing or formal partnership. You see donations versus purchase. These are all contracts. I think Russia was probably 53 or something like that. So again, you see China and Russia leading the world versus what you see here with a lot of talk about who's doing what. So I'm going to leave it at that because I know it's tight. Everyone's been listening for 3 hours. I don't want to waste other people's time, but I've not shown these slides. I certainly haven't decided to let them go, but I trust you guys and the recipients of this. So, Stephen and Hussein, please feel free to share with everyone. Thank you very much.
Thank you, Mr. Tillman. That was a very important and excellent presentation also Professor Gerace, the role of the economics and the factual nature of what the Belt and Road Cooperation means in reality is an extremely important point that has to continue to be made visible despite the microphones from various disinformation campaigns who do not wish that those kinds of facts and truthful results are being shown. And my point would be that cooperation does not exclude healthy competition. In fact, it generally would mean that healthy competition would be an improvement for all in terms of improving economic conditions as well as cooperation generally. So I think both of your presentations are extremely relevant and important to get out in various aspects, not only here, but in Pakistan and other places where these arguments which are being made that are not based on the reality or the facts will dissolve into smoke, and they should, because they're not based on reality. They're based on the political agendas of certain people. So thank you both. We have another
Stephen, can I raise one more?
now.
May I raise one more point I forgot, which is important? I'm sorry. I'm very sorry.
Yeah, you're welcome. Go right
ahead. I'm very sorry, but it's relevant to Pakistan. So what we talked we rolled it out. China's going to roll this out just like BRI in a series of spoken hub we talked about. But to show you how they're going to do this, it's going to be PPP. So the one example in the document, the big document, I don't want to bore you with, it's too big, was Ethiopia, where they're manufacturing kits in Ethiopia, joint venture, PPP with local players. They're manufacturing vaccines, Ethiopia, local player, joint venture with Chinese party on a PPP basis, and the same with logistics. And they've now moved that from Ethiopia in Q4. They've announced it in Q1 UAE, and they announced it 2 weeks ago in Pakistan. So there'll be a series of these regional plays around the world, and Pakistan is one of those three that have been named to be the future of this. So again, in a hub to then link it all together along the BRI, although it's much greater than the BRI, to be able to link this information together. Thank you very much, Stephen. I'm sorry I forgot that.
No,